Hey everyone, we are back with the plant-free MD, Dr. Anthony Chaffee. It's been a week or so since we've last spoken, and first of all, happy birthday.
Oh, thanks, man. Appreciate it.
My pleasure. And even though you're in your home, you're in the scrubs, so that's just fantastic.
Yeah, thanks. Well, I just came home. I just had a minute, so I was able to run back. It's much easier to talk here than in the office.
Yeah, absolutely. You've got a good setup there. Okay, so today's topic is a heavy one and somewhat a technical one as well. So we'll step through it slowly so that everyone, myself included, can understand what's going on. We're going to talk about cancer, and this is a topic that is particularly interesting for me because at Mackenzie's Meats, two of our most loyal customers who buy every single week are both recovering from cancer. They buy fatty beef. They like the high fat content. They're both women. And I know for a fact that a strict carnivore diet has been absolutely crucial to their recovery from life-threatening cancer. So when Dr. Chaffee suggested this topic, I thought it was a really interesting one to dive into. So welcome, Dr. Chaffee. I'm looking forward to getting into this.
Yeah, thanks very much. Yeah, I'm looking forward to it as well.
Cool. So I know this is basic, but could we just do a very short and simple explanation of what cancer is?
Yeah. So cancer is basically a misdevelopment of your own tissue. So your tissue starts behaving abnormally. So you may have skin cells that start behaving as not skin cells. So there's generally considered 8 cardinal mutations and changes that cause or define a metastatic cancer. So it has to be able to do a lot of different sorts of things. These cells have to behave in a certain way, and all together these things are able to act as metastatic cancer. So these are formerly normal cells that have then changed in some way for some reason. There's contention on exactly what causes that and what precipitates that, but either way, these started out as your own tissue and then have changed in form and function and are now acting abnormally. And the problem with them is they grow abnormally, as we know, but they also move around and they spread through different systems in your body, and they can start growing in different organs, and they cause multi-organ failure. They can damage you in multiple different ways. You can get sick easier. And eventually you can succumb from this for various reasons, either because this has caused so much damage to so many organs, you get multi-organ failure, or because you're just so susceptible to infections that you die from an infection. And obviously not everyone does succumb. Thankfully, quite a lot of people can recover.
We're made up of millions of different cells. They effectively aren't functioning properly. They go bad, and then we become sick, and we're susceptible to all sorts of other things going wrong throughout our body. And that's
yeah, exactly. And generally, the ultimate cure is complete excision. So if you cut out all of the cells, then those cells don't exist anymore and they go away. But when these things, because they can spread, and they can spread very easily, and you aren't able to see microscopic evidence of this while you're doing surgery, they can spread and then they can metastasize. But you get something early, you cut it all out, generally you can cure for basically everything except brain cancer. We find that if we even remove entire hemispheres containing cancer, it'll pop up on the other side potentially for primary brain cancers. So that suggests either this stuff is spread very quickly, or it's an overall disease process that's happening, and this is just going to keep popping up in different parts of the central nervous system as well.
Okay, yeah, sure. I mean, brain cancer, terrifying. I suppose if you had cancer, skin cancer, it happens all the time, particularly here in Australia. People get cut out, and often they're okay if they get to it early. So that's, okay, cool. Now I want to talk about cancer and ketogenic diets. When we spoke earlier, you mentioned that there were studies done 80 to 100 years ago into this very topic. I'm wondering if that might be a good place to start.
Yeah, so there was a very famous guy, Nobel Prize winner in medicine, Otto Warburg. He got the Nobel Prize in, I believe, 1931 for discovering that cancer cells don't use oxygen. So they don't have aerobic respiration. They use anaerobic respiration. We can look at this now, and we now know that cancer cells have to open these glucose channels. So they still run on glucose, blood sugar or whatever, but they need massive quantity, increased rates of it. So they generally pull in about 400 times the amount of glucose that your normal cells would do. And so that's because they run on anaerobic respiration, because they don't really have functional mitochondria. And that's something that will come into something we talk about later with the causes behind cancer, and some things that people are approaching it.
So just to stop you there, so anaerobic, does that mean that it's using glucose for energy? And so if we're doing anaerobic exercise, we're using glucose for energy. Is that the difference?
Yeah. So anaerobic just means without oxygen. Okay. That's anaerobic. So aerobic means with, air, with oxygen. Okay. So aerobic respiration means that you're using oxygen in the Krebs cycle and so forth, and you're producing ATP. So when you use oxygen in aerobic respiration, you get 36 ATP molecules. When you're anaerobically doing this, you only get 2. Okay. So it's much more efficient to use oxygen, which is why animals use oxygen.
Yep.
Cancer cells don't. And so they need way more glucose. So this is per unit of glucose, right? So, 1 molecule of glucose, anaerobically will get you 36 molecules of ATP, whereas anaerobically will only get 2 for the same molecule. And they're byproducts, right? Like lactate and so forth. And that's why we get that burn, because you have this lactic acid buildup, but then you have this called your oxygen debt. You breathe heavily for a while, then you stop breathing heavily, and that burn goes away. And so that's why it's kind of stupid when people say they work out and then 2 days later, like, oh, it's all this lactic acid, like that was gone days ago. But so that's the thing with cancer, is that they only work by anaerobic respiration. That's what Otto Warburg found. And so this is something that's come into play with the sort of ketogenic diet, because you're limiting the amount of glucose that's available to these cancer cells. So there's a guy, Dr. Thomas Seyfried, out of Boston. He's doing a lot of work, and other people as well, but he has a lot of published data, and he has a lot of talks available on the internet and YouTube and so forth, talking about this, and talking about how if you put people on a ketogenic diet and you limit the amount of glucose that's in their body, because you'll make glucose, but it will cap at a certain level. They also run on glutamine as well, and so he is developing pharmaceuticals that block out glutamine in your body. And so these are 2 of the major energy sources, food sources for cancer cells. And he's finding that you get extremely good results. If cancer, and he's not suggesting that you forego, chemo and radiation, all the traditional things. And I'm certainly not either, but this is something adjuvantly that you can use to help yourself. And what I talk to my patients about when they always ask me, well, here are the treatments and here's everything we're going to do, but is there anything else I can do? And well, you can be as healthy as you can be. You want your body to work as well as you can, because your body and your immune system are really what's fighting this stuff off. You have people that have autoimmune disorders or are immunosuppressants, their cancer rates are way up. So our bodies are fighting this stuff off. And if you support yourself and support your body's going to support you. So yes, Dr. Seyfried has found that is quite helpful in treating cancer, and he's showing histologically. So he's taking cell samples and looking at this, and these cancers are just receding on their own. In Hungary as well, that treats people, specifically treats them with ketogenic or a carnivore diet, and they find that these cancers are really just being eliminated much faster and at a much better rate than traditional therapies alone.
That was very interesting. I might just unpack that a little bit, because on one hand, we're talking about making sure that we're as healthy as possible. And you mentioned that people who've got like metabolic illness or other issues are more likely to have cancer. And then on the other hand, we're talking about restricting the glucose that the cancer cells actually feed on. So sort of coming at it from both of that, you can come at it from both those angles with the ketogenic or carnivore diet.
Yeah.
Which I think is very interesting. I think you also mention like irritable bowel disease and sort of gut-related gastrointestinal issues that a lot of people suffer from, and you're saying there's a correlation between those issues and cancer rates. Is that?
I mean, there are, yeah. I mean, well, if you look at especially like ulcerative colitis and so forth, this is a chronic inflammatory process, and if you don't get that resolved, basically you have a 100% chance of getting colon cancer. And so quite often when people have ulcerative colitis in their early 20s, they just get a total colectomy. Ulcerative colitis, definitionally only affects the colon. And so if you remove all of that, then, your risk of cancer is eliminated. But, we know since, the 1800s with Dr. Salisbury, who was, curing these people and other autoimmune disorders such as rheumatoid arthritis and so forth, that putting people on a pure red meat and water diet, eliminates this. And we even have studies more recently showing that like an elemental diet, really like eliminating out most things and getting, a very basic diet has a better efficacy in treating ulcerative colitis and Crohn's than even steroids. So high dose steroids for acute instances of flare-ups. And, so it's better at settling down those flare-ups. And it's also better at maintaining people, without flare-ups. So, diet is very much involved in these sorts of things. As far as a ketogenic diet and, preventing ulcerative colitis from causing cancer, maybe, ulcerative colitis is a very devastating illness, and it's going to cause serious damage kind of no matter what you do. But if you, put people on like a carnivore diet, people are just eliminating their ulcerative colitis without the need for surgery, which is, fantastic. Same with Crohn's. And
in terms of limiting the glucose that the cancer cells can feed on, so does that mean that they will effectively starve? Or what's the process that happens there?
Yeah, well, it definitely slows them down. And so, they're not able to get that 400 times, glucose level that they want. And so they aren't able to grow at the speed, that they would have otherwise. And this gives your body a chance to fight these off more effectively. If this is just growing out of control, then your body's going to have a really hard time containing that. If it's more mitigated and slowed down, your body has a fighting chance. And, it gives the, chemo and radiation, a better chance to help as well. The other thing, comes into play is that there's this whole idea of like the genetic theory of cancer, where you have these genetic mutations, whether you have some sort of exposure or you have a genetic issue that makes you, more susceptible to getting genetic changes in your cells. And eventually you get all these genetic changes and you have cancer, right? And if things that are pre-cancer, they're almost there, but they're not quite there. That's being challenged by people who are arguing for a metabolic theory of cancer, where there's something, they say there's something going on in your metabolism that's actually helping to precipitate these genetic changes and the formation of cancer and the behavior of cancer. So Dr. Seyfried, again, has done different work, and other people have as well, showing that the respiration of our mitochondria, which make our ATP, which use glucose and oxygen to either respirate by aerobic respiration or anaerobic respiration, depending on what we're doing, find that these acting dysfunctionally is very much implicated in the propagation and behavior of cancer. So Seyfried did some studies looking at, because cancer cells, when you have a tumor, people think it's like, oh, this is just monoclonal. This is all the same cell, and you have this change, and all of a sudden this is a cancer cell, and that cancer cell will boom. But that's not the case, actually. You look at these different cells; they don't all have the same exact genetic changes. They have certain ones that have these markers, but they're all behaving the same, even though they have different genetics, to an extent. And so he was taking these things. He was taking the nuclei that has the DNA of these cells. He took those out and put those into a healthy cell with normal mitochondria and normal organelles, and it did not behave as cancer. But he took the mitochondria out of the cancer cells and put those into a normal cell with normal DNA and normal nuclei, and the rest of the organelles normal, and it did behave as cancer. So there's something else going on there. There have been multiple studies on the ketogenic diet that look at specifically mitochondrial respiration. And they find that on a ketogenic diet, basically just getting rid of carbohydrates and sugar and so forth, makes your cellular metabolism work a lot better. Now, I've mentioned this a lot, that I think that carbohydrates fundamentally disrupt our macro metabolism, our energy mobilization and usage in our body by increasing insulin and so forth. But it also works on a cellular level as well. And so it disrupts down to the mitochondria how our energy systems work. So it's not good stuff. And that's why I completely avoid it. But they found that in these studies that the respiration efficacy and efficiency of these mitochondria, was up to 4 times as efficient and effective. So they were working much better. But they found that you actually had more mitochondria as well, up to 4 times as many mitochondria as well. So you now have basically a 16-fold increase in the energy efficiency and metabolism of your cell. And so when you put these two things together, that you have these, dysfunctional mitochondria precipitating genetic changes and behavior and cancerous behaviors, or at least suggestive of so. And, you have a ketogenic diet that shows that you get much better cellular respiration and mitochondrial respiration and function, then you have to sort of wonder, okay, is this going to matter? So, Warburg found out that this stuff runs on anaerobic activity, so it needs massive amounts of glucose, and that's what Seyfried found. And so if you limit the glucose, that's going to help starve out the cancer. But if you are getting, if you're getting rid of carbohydrates, that's going to make these cells function more normally anyway. So that might be a factor that actually helps reverse the disease process, which is cancer. And that's something we need more studies on, and we need more data on, but it's certainly a very interesting avenue.
Definitely. Okay, so that was fairly technical for your average person.
Sorry.
Were we talking about, again, like both starving the cancer cells by not giving them the glucose, and then also helping our existing body cells function better because they're not receiving the carbohydrates and the glucose? Was that the kind of like, was it that sort of like two-pronged attack?
Yeah, and also, potentially these cancer cells, can start, reversing themselves, because if their cellular metabolism starts correcting itself, it could be that they revert. I don't know. I haven't seen a study that says that.
So that's a
potential mechanism.
The cancerous cells could revert back to being regular health.
Well, potentially. I mean, I think that's a potential thing. I think that's a very important avenue for research and to look into. But yeah, the potential is absolutely there.
Mm.
And that's potential for like the model for why these things behave as cancer, and you sort of reverse that. You take that away, you're getting to the root of the disease process, and so instead of treating a symptom, we're treating a cause. And so if that's one of the causes and you take away that cause, you're knocking the legs out from the disease process.
I'm sort of thinking about like your average person, how they can take this information and apply it to their own lives. I suppose like the obvious way is to make sure that you're metabolically as healthy as possible, and perhaps experimenting with a ketogenic or a carnivore diet could be a really good way to ensure that you're as healthy as you possibly can be. And that can be body composition, and then also just like how much energy you have. I find it's a pretty good indication of how healthy you are. And I mean, I'm trying to think that if I was like diagnosed with cancer, I would certainly do a hell of a lot of research and try and find if there was something that can help me. I mean, should people be reading into more of Dr. Thomas Seyfried's stuff, or where should people go to get more of this information?
Yeah, I think Dr. Seyfried is is a very good source for this. He's published a ton of stuff. It's spelled Seyfried, and we can use put some
We'll link to it.
Show notes and things like that with links to some of his stuff, where people can find him. But it's obviously people should do their own research as well. There's a lot of conflicting data out there. There's a lot of people that tell you like a vegan diet is really going to help you and so forth. And maybe it does, but in comparison to what, that's always my argument with the vegans. Say, well, I feel so much better. You're having these better outcomes. Like, okay, compared to what? Did you only drop off meat? Usually not. Usually they say, oh, I've gone whole food. I stopped eating sugar. I don't drink soft drinks. I don't go to dinner. Like, I make all my food and so forth. I'm not really eating, carbs and processed crap. So they're changing a lot of things. Most of the things that they're eliminating is actually, plant and sugar material. Okay. Not meat. They may have gotten rid of meat as well, but that's throwing the baby out with the bathwater. They shouldn't have done that. But they've eliminated things off that are quite bad for them. And so they feel better. Of course they feel better. They've just gotten rid of some things that are very toxic to them. So, compared to people eating really the wrong thing, the worst things, people eating, a vegan diet and, that isn't optimal, is going to give improvement. Obviously it will, but that's not to say that's the best thing that they can do. And so it's important for people to sort of, look at the evidence and weigh the evidence and see how strong it is and see, what they think and what they believe, because one of the most important things with cancer treatment is you really need to buy into your treatment. Whatever your treatment is, whatever you're going to do, you need to believe this will work, because it just seems to be one of those things that when people are just like, yep, positive attitude, this is going to work, we're going to do this, we're going to go right after this, they do better than the people that have just basically succumbed and just say, there's no hope, there's nothing I can do about this is me, I'm not going to make it. They do quite a lot worse generally when they give up hope like that.
Totally. Yeah, that's really powerful. I mean, like most things, I suppose it's between the ears. If you're willing to do the work and you believe that whatever you're doing will work, and that you're going to survive, I imagine that would be a massive factor. And it would flow through to everything. If you are going to do a vegan diet, as you say, make sure it's a really clean, whole foods vegan diet. If you're going to do some form of exercise, you make sure you're doing your exercise every single day. You make sure you're not drinking alcohol and that you're giving yourself the best chance. So yeah, that's obviously a huge factor.
Not immediately obvious that diet plays such a role, or that even our environmental influences cause all that much of an influence on cancer rates. But if you look at the cancer rates before 1980, they were about 1/3 of what they are now in America. Okay, so something's gone up, and that's not our genetics. We haven't had enough. And your population genetics just simply don't change that quickly. So something happened in the environment that increased, our cancer rates by threefold. I think that that's to do with diet. That's right around the time that the USDA said that fat and cholesterol were bad for you and cause heart disease. So people stopped eating that, and they stopped eating meat along with it, because meat has fat and cholesterol. Same with eggs. And then they started eating more fruits and vegetables. We reduced our cholesterol intake by 33%, reduced red meat by 30% to 35%, and increased fruits and vegetables by 30 and 40% respectively, and grains and sugar as well, dramatically. The effects were that, among other things, the cancer rates have tripled, but also obesity rates have tripled, stroke rates have tripled, heart disease rates have tripled, type 2 diabetes increased by, 6-fold. Autoimmune disorders, Alzheimer's, Parkinson's, autism, these things all have increased exponentially. It almost didn't exist before then. The part that I find interesting is they all increased at roughly the same time. They all had this big curve up at about the same time. And so that's completely abnormal. People say it's like, oh, well, we probably just weren't, keeping track of this, but, we were keeping close eyes on these sorts of things. We've had, some of the most amazing doctors who have ever lived during that time. And a lot of these people were noticing these sorts of things and noticing these trends go up and so forth. And we're talking about it.
I think another way of kind of validating it is when you look at Indigenous populations who clearly were eating a totally different diet, and then their life and their diet just goes completely off track as soon as they hit that kind of processed food era, which was the same time period, sort of halfway through the last century, when things started to go really off the boil in terms of lifestyle diseases.
And they had, their disease uptick was far higher than Western Caucasian, even most Asian populations, because they hadn't been exposed to these sorts of foods for as long as we have. People from European descent and so forth have had the agricultural revolution around 8,000 years ago. So we have some defenses, but they're not complete, and so we still get these problems from eating species inappropriate diets, but they get a far more dramatic impact. And so this is why in medicine in Australia, you basically consider a native person's age to be 20 years older than it is. If their sticker says 40 years, you just treat them as you would someone who is 60, because that's probably the problems that they're going to have is that of a 60-year-old. That doesn't need to happen. And when you go back to your, when they go back to their, nutritional roots and they start eating traditionally, as many still do, they reverse those problems. They reverse them. It's not just that they slow them down or stop them. They reverse them. They go away. And there is something that, if we can, increase it, if we can triple the rates of cancer, then, we figure out what that is. We can, slash it by 2/3 quite easily, as long as we recognize that what that is. I think that it's dietary related. I think that's, looking at the data and looking at what happened and the timing of it all, I think that is the most likely culprit. But it is something happened. And, if we identify that and get rid of it, we'll be in much better shape. The other thing is, people say that, just on the subject of cancer, people talk about how, well, red meat causes bowel cancer. And it's like, no, it doesn't. That was a really crappy epidemiological study that only showed an 18% increase in correlation. Again, is not causation. And these epidemiological studies, they're meaningless unless you get at least a doubling, like a 200% increase in correlation. Again, correlation. This didn't even have that. It didn't even meet, didn't even get on the radar, but people latched onto that. And they've just been repeating this for so long that just, people who haven't actually looked into this are just doctors as well. I hear, colorectal, surgeons talking about, oh, you got to avoid red meat. It's like, no, you don't. These epidemiological studies have been redone because there's a lot of confounding factors, and, they weren't great studies, and they cherry picked out which, data sources they wanted to use very, unscientifically. And when these things were redone, they didn't even find a correlation. They didn't even find any increase in bowel cancer rates or any other kind of cancer rates, well, with red meat or any other kind of meat. So there isn't even a correlation between eating meat and red meat and cancer, especially bowel cancer. Then there are a ton of other studies as well, looking at different aspects of this. So, people that have higher, there was a study I saw that people that had higher LDL cholesterol had much lower all-cause mortality, and specifically breast cancer rates and breast cancer mortality. So it's multifactorial. There's a lot of things that go into it, but all roads lead to Rome. And you have higher cholesterol, you have less carbohydrates, you have better cellular metabolism, you have better macro metabolism. These are all getting you back into your natural state that you would be in if you were on a high-fat carnivore diet, or even a ketogenic diet. But carnivore, I would argue, is much better, because you're getting rid of all plant toxins and so forth. This is just how our bodies are supposed to run. And when we start eating things that aren't good for our bodies, it throws a wrench in the gears, and our bodies start working abnormally. Cancer is our body working abnormally. Now, you can have people that have genetic conditions, and they just are going to get cancer no matter what you do. You get babies being born with brain tumors. That's awful. But the ones outside of that, are preventable. There are preventable cancers.
Then,
we know that, there's a whole bunch of different things, smoking and so forth.
Even then, when the babies are born with cancer or major issues like that, it's likely that there's some sort of environmental impact that's going on there, whether it's radiation or whether it's poor nutrition from their mother or what have you. It's, I can't imagine that's something that would occur naturally in a very sort of primitive environment.
No, I don't think so either. I think that there are going to be some cases you're going to get some de novo mutations and problems that you can have, and then that baby dies and doesn't pass that gene on. So you get, a once off fluke that the fetus didn't develop properly and had these severe problems. That can happen. But I do wonder, as you suggested, like how many of these are preventable as well based on the diet of the mother. If the mother was eating like a carnivorous diet, would her child have had that? I don't know. It's impossible to answer that right now. But once you get enough people having fully carnivorous pregnancies, maybe you can start seeing that. That instance where you have cancers forming in a child that young and that early is super rare. So it may not be that we may not be able to get the population numbers that we need to really look at that for quite some time, if ever. But you have to wonder, because this certainly affects us as adults. It affects the elderly much more than it affects the middle-aged people and young adults, but it affects the developing the most. So a developing fetus is going to be hit hardest by an inappropriate diet. And you can only wonder what we all would have been like if we had all developed as carnivores. And I think a lot of the tragic early childhood issues could have been avoided. Obviously, not all of them, but it's you do have to wonder how many of these would have been prevented or preventable.
Yeah, it's such an interesting topic, that early childhood development. Like, what could we all have been if you had that? I mean, you're never going to have a perfectly optimal scenario, but if you did have sort of something close to it in terms of body and mind development,
Yeah.
All right. Is there anything else you wanted to add on the cancer topic, Dr. Chaffee?
No, I think that covered a lot of it. I think, I would encourage people to go look at, Dr. Thomas Seyfried's work, his papers and his talks. I brushed on, a bit of it, and hopefully I didn't misrepresent his work too much, but, or getting, many of the specifics wrong. But if you want, in-depth analysis on those sorts of things, definitely check his work out. He's on YouTube, and his papers are, peer-reviewed major publications.
Awesome. Yeah, I'll be doing some research into that, and I'll share some links in the show notes to
sounds good
as well. Excellent. All right. Dr. Chaffee, the Plant Free MD, thank you very much for delving into that complicated topic. I feel like I know a little bit more than I did before, and I realize there's a lot more to know as well. So I really appreciate you sharing that.
Yeah, not a problem. I'm happy to have a chat. And yeah, obviously it's a massive subject, and there's much more to cover, but that's good for the broad strokes anyway.